Okay, there we go. Good morning, everyone, and thanks for joining the Clallam County Economic Development Council Coffee Chat, Coffee with Colleen. We appreciate you joining us today. And we have a community leader and friend joining us today, Wendy Sisk, who is the CEO of Peninsula Behavioral Health, a really critical organization in our county that over the years is becoming more and more critical. And I think they really do a fantastic job with uh, dealing with the essentially crisis that so many people are going through, so many more people. And she is not just uh, a, uh therapist and a professional in that regard, but also has taken on the hat of developer because it we don't have enough in our community and we've got some real big problems to solve. So with that, thank you so much, Wendy, for joining us. And I know you have a PowerPoint you're going to share and talk to us about what's been happening at Peninsula Behavioral Health. So take it away.
All right. Good morning. It looks like my PowerPoint worked.
Yep.
So, as Colleen said, my name's Wendy Sisk. My son, who's a freshman in college this year, just found out that I am actually a licensed therapist. This was news to him because I've been in administration and leadership roles for the majority of his life. So, I've been at Peninsula Behavioral Health for about 21, 22 years, something like that. And I've had a lot of jobs. The most recent being developer. So as Colleen mentioned, and so we'll get into that in a little bit. First, I wanted to just jump right in and tell you guys a little bit about the organization. I think most of you are familiar with Peninsula Behavioral Health, but I'm always surprised when I do these conversations that there's always somebody who just doesn't know who we are or what we do. Oh, and I'm trying to figure out, oh, there we go. Now it's advancing. So we are essentially your primary community behavioral health provider for Clallam County. We do have a partner agency, West End Outreach Services, that serves the Forks area and the west end of Clallam and Jefferson County, but we serve all of Eastern Clallam County. And what that means is we see about 1 in 20 residents of Eastern Clallam County in any given year. Our goal is really to provide, comprehensive behavioral health care to our community members, and that means a lot of different things. So we'll talk a little bit about the services and programs. We are a 501c3. We have a board of directors who are volunteers who give a lot of their time and energy to support their crazy CEO who wants to do all kinds of new and exciting things all the time, and they're really great about helping us move initiatives forward. We operate with a budget of about $16 million a year now. And I think when I got here to PBH, our budget was somewhere around like 1.5. So over the last 20 years, the organization has grown and changed a lot over time as we continue to try to meet the community need. So we provide treatment services to individuals and families experiencing all kinds of behavioral health needs, but primarily our focus is on the moderate to severe population. So I think about the analogy with primary care that most of you who have diabetes probably get that care done at your primary care office, but some of those individuals might need to see an endocrinologist. So the endocrinologist is the specialty care for diabetes, and we're the specialty care for behavioral health. We accept all insurances. We don't decline care based on the ability to pay. So that means we see a lot of Medicare and Medicaid individuals. We see people with high deductible health plans who can't meet their deductible, but they still really truly need care. We see Regents and United Healthcare and Aetna. So even if we don't take an insurance on a panel, we're really great about finding a single case agreement. And we also provide a lot of care to our veterans in our community. So we really try to make sure that our services are accessible. And if there's something somebody truly needs, we don't like finances to be a barrier to that. And we do a lot of fundraising and working with community partners to ensure that we have dollars to cover that uncompensated care and to really work with folks. So we have a broad array of care. And I'm not really great at just reading PowerPoint slides, you guys, so bear with me. Our services range from basic assessment and referral services to what you would normally think of with behavioral health in terms of psychotherapy and medication services. We have a staff of 6 psychiatric nurse practitioners on our team, as well as counselors and case managers and care coordinators and peer support specialists. We have about 10 people, I think, right now on our outreach services, targeting people with both mental health and substance use disorders who are unhoused in the community, as well as some new programs I'll talk about where we're targeting some folks who have been in and out of jail services. We have a part-time position that does jail transition work, so people who are in the jail and coming out, an opportunity to work with them and try to get them tied into services before they're leaving incarceration, and also provide some transition and care for them on the way out. We also provide 24-hour, 7 days a week crisis intervention services. And that for me was really my clinical background, as I worked in our crisis department for over a decade, providing intensive crisis intervention services in the community, in the emergency room, at juvenile detention, in our schools, and anywhere else in the community that's required. Paired with that, we also have a 6-bed crisis stabilization program where if somebody needs a little bit more intensive support for a few days up to a couple of weeks, we can provide that in our crisis stabilization program. So 24 hours a day, depending on individuals' needs, medication services, counseling supports, other activities. And sometimes for people, it's just a break from the day-to-day grind. We know that since 2020, everyone's stress level is a little higher than it used to be. We talk a lot about trying to get back to normal, and I don't really know what that means anymore. When we went into the pandemic, we really expected to see a huge surge in depression. And what was interesting is that's not really what we saw. We saw a huge surge in anxiety. So we know that people's stress, their ability to manage their emotions, really got challenged in those first months and couple of years through the COVID pandemic. And we're seeing that people have not necessarily level set to where they were before. So we're seeing more outreaches from schools. We're seeing more requests for training and services. We have a great training program called Mental Health First Aid that we get some support from the county and from the United Way to provide free to our community members. And if I was smart, I would have brought that training information, but it's available on the PBH website. We want people to know how to help one another, because the professionals aren't always the right answer. Sometimes it's a family member or a neighbor or a loved one who really helps guide somebody through a tough time in their life. And then over the last few years, we've really increased our housing supports and our employment supports. So we're contracted with one of the Medicaid managed care organizations to provide this program called Foundational Community Supports. Foundational Community Supports is really saying, well, we know people are more successful and healthier if they have stable housing and if they have the ability to have a sense of purpose. And with that, that's often employment services. So we're really trying to look at the whole person. Also, over the last several years, we've added primary care into our mix, and we're never going to be the primary care provider for, the average person in the community. But there's a small cohort of people who really have struggled to have their treatment needs successfully met in the primary care setting, whether that's because they're uncomfortable in the office or it's just too hard to motivate oneself to go. And so we've actually brought primary care into our office, and we see about 100 to 125 people in our primary care clinic. We have one provider. And with that, we've identified skin cancers and breast cancers and many cases of hepatitis C, which is treatable now, and really help people manage their chronic health conditions. Because we know people with severe mental illness are some of the biggest drivers of overall healthcare expenditure. They're some of the most expensive individuals in the healthcare system, in part because we often see comorbid health conditions like COPD, cardiac conditions that are really common, either associated with behaviors of serious mental illness or even associated with challenges with medications. So medications that treat these illnesses can sometimes be really, really hard on the body and increase those individuals' risk of having other health conditions. So we really try to focus on providing all of the behavioral health services somebody needs under one roof. We also have a substance use disorder program that is expanding now, not just to adults, but is also serving kids as young as 13. And I think it's been surprising for some of our staff how many youth are really struggling with not just smoking some marijuana or drinking alcohol, but we're also seeing fentanyl and methamphetamine use and other significant substance use with our youth. And we know if we can intervene earlier, their long-term outcomes are better. And you guys can interrupt me at any time because I can ramble forever. I wanted to share that in the last year, we've added some new and additional programs. And the first one I just wanted to mention is called New Journeys. And New Journeys is a program that is designed to address first episode psychosis. It provides a host of services with a significant treatment team that wrap around an individual during their first episode of psychosis. So that could be a first episode of schizophrenia or a major depressive disorder with psychotic features, or just psychosis that we haven't quite figured out what's going on. Because we know, again, if we intervene early, if we make sure we have stable housing, if we get people on a path to employment, their long-term health outcomes significantly improve. So we're working with the state of Washington to take a model that's been launched in other urban areas of the state, and we've been asked to adapt that model to the rural environment. You guys know, living in a rural community, that sometimes it's hard to do things when you don't have an economy of scale. So New Journeys has been a great opportunity for us to work with the state to try to take a model that's working extremely well elsewhere and figure out how do we make it work with much smaller numbers. Because we're never going to have 100 people in a year that have a first episode of psychosis like they do in King County. We can't facilitate those kinds of numbers. So we're trying to figure out how do we adapt the team and how do we adapt the program to provide that same level of care in a meaningful way without the significant increase in resources that it takes to do it for a large scale of folks. The other two programs that we've launched this year are two forensic programs. For those of you who are tuned into the court system or the behavioral health system, you might have heard of the True Blood lawsuit. So about 8 or 10 years ago, the state was sued relating to the number of people who are sitting incarcerated waiting for competency evaluation and restoration. So these are people with mental health concerns sitting in jail, waiting to be evaluated for their due process. So Washington State was found to be not in non-compliance with that due process. And the True Blood lawsuit was the result of that. And each day that the state is not in compliance, they get fined something to the tune of about $100,000 a day. And those dollars are being reinvested in supports for those individuals. They're also being invested in solving the problem, increasing the availability of competency evaluation and restoration. But the state's sitting on many millions of dollars, and part of what they're doing with that is asking us to step in, identify some of those people with mental illness who are at high risk of coming in and out of jail, who have been True Blood class members or potentially True Blood class members, and help them find housing. So the FHARPS program is a housing support program that allows us to identify housing resources, help subsidize that housing for a period of time while we help that person become stable, and provide in-home supports to them. The challenge with that, anybody?
Not enough housing.
There's not enough housing. So if anybody knows of somebody who would love to rent to us, we'd love to do a global lease and to have some housing available. That's a real challenge. And so I'll talk a little bit more about housing down the road, but we're actually in the process right now of writing a grant to be able to buy 1 or 2 houses to be able to do some of this housing for this population, because they tend to be a very difficult population to house. And if somebody also has a history of sex offense or arson, if they don't have housing with a family member, they're probably not going to have housing. It's just an incredibly difficult population to support. And the
So what would the ideal home look like? Are you looking for a 3-bedroom, 2-bath, or like an 8-bedroom?
Yeah, probably 3 or 4 bedrooms. I think, we're gonna write our grant application such that we're looking for a 3 or 4 bedroom house. I think that, there's value in having some support, but then when you get too many people in one place, it can create complexities as well. So, and again, the FHARPS program is really targeting those people who are intersecting over and over with the criminal justice system. The FPATH program is the sister program that is funded by the same source, and it's really about homeless outreach and helping link people who are in and out of jail, who are unhoused, in with the FHARPS program, in with other services and supports, again, in hopes of interrupting that in and out cycle. I think we're not supposed to say frequent flyers anymore, but if you were to talk to our friends, Chief Don Wenzel over at the jail, or Amy Bundy, our chief criminal deputy over at the county, they would tell you there are a number of people that just cycle in and out, in part because they're just not eligible for other housing resources. So we're really looking at how do we interrupt that cycle, and how do we provide some additional supports to hopefully keep those individuals in our community, as opposed to utilizing all of those emergency resources and corrections resources. So I think really the reason I was invited to come today was to talk a little bit more about housing. Colleen and I were talking before we started today, and PBH has done housing as long as I've been here. I know we've been doing housing at least since the mid 80s. I really think probably further than that. And it's because there's a cohort of people that is just challenging to house. They have some interpersonal challenges because of their mental illness. They may have other difficulties. And we've found that there's a cohort of folks that really need some extra supports to be successful. Not everyone is designed to live independently in an apartment all by themselves all day, all the time. And so PBH really started with some group houses. We have, I think, three right now in Port Angeles, where we have shared living arrangements where we have staff in and out to support people. And then we also had a 19-bed, essentially group home. And we closed that program in about 2 years ago because the building had just had so much deferred maintenance. It was all but falling down around our ears. And as an industry, we're moving away from large institutional group living sorts of situations. Really, we helped place those individuals either in independent housing because they were ready, smaller group housing, as opposed to having 19 people with serious and persistent mental illness sharing 2 bathrooms in one house. So that model was kind of going by the wayside. And we also had a building that had probably 40 years of deferred maintenance on it at best. And the cost of renovating that building at that point just really didn't make sense. But we know that when we have a chronic health condition, if we don't have a safe and stable place to be, the likelihood that we're going to follow up and take our meds as prescribed is next to none. Our ability to follow up with appointments is very limited. Imagine, last time you had a prescription of antibiotics, did you ever miss a dose? I did, because I ended up at the end and there was one extra pill, and I have a safe place to be, and I'm not struggling for survival every single day of my life. So we know homelessness and mental illness is a bad combination. And we know that we've shown that we can do a really good job supporting people and helping them move through the phases of supported housing and into independence. So again, right now we currently have 3 supported living houses in Port Angeles. This is one of them. Here, single adults live as roommates. They are co-ed. Our residents are all adults. We don't house anybody under 18 in our houses, because people are adults and they have conflicts in their houses. Part of our job is to help people learn to live together. Did anybody have a roommate in college? I did. It was not always easy. And, and I like to think that I don't have a serious mental illness on top of it. So one of the values of being able to do this work with folks in these shared houses is that we help them develop some of those life skills that are really, really important, that many of us have other opportunities to learn over time. So then about in 2022, I know Commissioner Johnson's on here today. I said, hey, Commissioner Johnson, there's this motel. And if we bought this motel and we put like $200,000 into it, I bet we could turn it into housing. And so $5 million later, we have the Donview Court Apartments, which couldn't have happened without Commissioner Johnson bringing a whole bunch of community partners together saying, okay, there's this project. What do we want to do with it? How do we want to make it happen? And how do we leverage local dollars to bring in other federal dollars? So again, Donview Court was close to $5 million. It's 26 units of housing, 21 are permanent supported housing, 4 are transitional housing that are attached to our mental health court, and 1 is a market rate unit, which we reserve for a veteran who would be otherwise over income for this housing. We worked with the city and the state. They bought us the motel. They had faith we could get a grant to renovate it. And we applied for a grant and we failed. And so we applied for the next round of funding and we got the funding. And we had a lot of challenges and problems. We had some water damage. But at the end of the day, we got through. And after about a year, we opened the Donview Court Apartments. These are largely studio apartments. There's a couple of 2-bedroom units and I think 5 1-bedroom units, but they're largely very small studios. But the picture here is of a kitchen in a studio unit. So every single unit has a proper fridge, a proper stove, and a proper sink, proper bathroom. So people have the facilities to live. If you put somebody in a hotel room, you're sheltering them. You're not housing them. People really have to have the ability to provide for themselves in their unit for it to be truly housing. So in the past year, we reunited 6 families. So parents with kids who had kids who weren't living with them, either because of DCYF involvement or because they just didn't have a place to be. And so those kids were staying with others. We've only had 2 people leave the permanent supported housing units. We've done 0 evictions. The fire department tells me they've had exactly 2 EMS calls in the year we've been open, and those were both for diabetic emergencies. We've had 3 law enforcement calls. The most recent one was this week where somebody called and said, hey, somebody left some needles in a shopping cart behind the building in the alley. And that individual told law enforcement that they did so because they knew that that wasn't allowed. They couldn't bring any sort of drugs or drug paraphernalia on our property. When we built Donview, we had a lot of questions from the community of, was this going to be safe? Was this going to be a problem? Dr. Hallberg has his clinic right next door and an Airbnb right next door. And I check in with him periodically. They've had no issues. And part of that is we provide a lot of support to our residents in our housing. So when I finished Donview Court, Commerce asked me, Wendy, will you do more? And I said, we have to make sure we can do it and do it right. And I feel like we've kind of got it dialed in at this point. We know what we're doing as it relates to housing. So Colleen said I should add developer to my job description. And, the problem is there's still a housing crisis. And my tolerance for there being a problem that there should be a solution for, but nobody's doing anything about it, I can't sit with that. So we are continuing to talk with our board about what is our piece. And we're not going to solve the housing crisis. We're not building housing for the average person in Clallam County, but there's a targeted population that no one serves better than us in this community. And we're going to keep chipping away at that. So we're actually in the process right now of transitioning our old office in Squim into another supported living housing. I'm going directly from here to meet with the contractor who just got the bid for that project. And we're going to be converting that old office into a 5-bedroom supported living house for 5 single adults. It'll be ADA accessible, which will be nice because this will be our first supported living house that is ADA accessible. You all live locally. If you've been in some of these older homes that there's weird stairs in places and narrow doorways and things like that. So that's been a limiting factor for us. And we're able to do this project because we have support from Clallam County. So Clallam County is providing us some of their affordable housing tax dollars to help do this renovation. So we're really excited about that. And we're hoping to occupy this house by the end of summer. And in Port Angeles, PBH purchased a house that was adjacent to our property because, well, we surrounded it on 3 sides and it seemed like the right thing to do. and the condition of the house is really, really poor. So the city of Port Angeles is supporting us with some of their affordable housing dollars to renovate that house back into viable, livable housing, where we'll also provide supportive living supports. And then I went to my board and I said, we have this property over on Second and Oak, and what do you guys think about trying to do something a little bit bigger? And so this is a concept drawing of a 36-unit permanent supported housing building that we plan to build on the corners of Second and Oak Street in Port Angeles. And if you're trying to picture where that is, we're right at the top of the switchbacks that come up behind Country Air. And we own 2 lots. We have one of our transitional supported housing units there, as well as the old Arlene Engel home, which will be either moved or coming down. And we looked at moving the parish house, and there's some challenges with that, but we have a community member who may be doing so and will preserve that housing for the community. So to pave the way for this project. And this is not my first development in Port Angeles. I created the CCRC with our team at PBH several years ago and did our children's center renovation. And we often get a little bit of pushback about some of our projects or our housing siting. That is not true in the Second and Oak neighborhood. And I just can't say enough about what an incredible group of neighbors this is. We were over there with our architectural team, and they were just shocked by the number of neighbors who came out and said, we're really excited to see what you guys are going to do. And we're actually hosting a meeting on Monday with our neighbors to talk a little bit about what this looks like and what it might mean for the neighborhood and what sort of supports we'll have in place. So this is our landscape plan. I know it's kind of busy, but I just wanted to share. So we have 2 city lots, and we are going to take up almost every square foot we can with this building. Where you see parking on the south, the building will actually hang over the parking. So we'll have units above the parking, but we will have a really tight footprint on this building in this neighborhood. You can see lots of trees and shrubs and grass. And so it is our goal to not have this be institutional looking. We want it to be a place where people want to live. I think some of our neighbors might be jealous because all of our 2nd and 3rd and 4th floor units on the north side will have a water view, and our 2nd and 3rd floor units on the south side will have a mountain view. So we're looking forward to sharing that with all of our residents. So we're looking at having 4 2-bedroom units, 25 1-bedroom units, and 7 studio units. And 2 or 3 of those will be designed as ADA accessible units. So we'll have roll-in showers. Our doorways will be a little bit wider. We'll make sure we have ample space for folks to turn around. When we did Donview Court, we were really limited by the existing building. Some of those studios are as small as about 238 square feet. So the studio that you see on the right in this image is actually closer to 400 square feet. So the building in total is about 28,000 square feet. And so we anticipate anywhere from 40 to 60 residents in this building. And right now we are sitting on 150 applications for Donview Court, and that's without soliciting any applications. And so we know that the need is great, and this won't fulfill the need, but we're hoping that it's really going to make a dent. So in addition to the units, there will also be a centralized laundry room. There will be a community room, which is actually going to be located on the 4th floor with a view out to a rooftop deck that overlooks the water, because we want all of our residents to have access to that spectacular view that we all like to enjoy when we have a chance. In our centralized laundry room, at the request of my staff, will also be a dog wash sink, because one of the barriers to individuals in our community who are homeless in accessing housing is, I don't want to leave my pet. And, one of the lessons learned at Donview Court, we have about 6 or 8 animals up there right now, but our staff feel really, really strongly that they would like to see people be able to have pets. So we're going to give it a go and design this building with that in mind, with hard surface floors, and really try to make this as much of a community building as we can to meet the needs of the people that we know we're having the most difficulty housing today. So it's not cheap, guys. We have secured probably about a little over $3 million in funding today. So Clallam County has committed $2 million in 1590 and 1406 affordable housing dollars. So these are tax dollars that the county's been collecting for the last couple of years to help support the construction or rehabilitation of low-income housing. So these dollars are attached to requirements of 60% AMI or below. We anticipate a significant number of our units being at 30% AMI or below, because again, that's a population that has some of the greatest difficulty. And what that means for a single adult is somewhere in the neighborhood of about an income of $14,000 a year or less. We also received a $750,000 donation from a local community member that actually kicked this off. And we applied to the Americas Foundation for a grant for $125,000, and they called and said, our board really talked about this for a long time. They talked about fully funding your ask, and instead they wanted to come in at $200,000. So I don't know how many of you have ever applied for grants, but nobody ever gives you more than you ask for. So I know that that's one of the things that's made me most proud, is that people are looking at this project and saying, we want to support it as much as we can. We've also received a $40,000 grant from Enterprise, and that was for pre-development costs that help pay for our geotechnical survey and our land survey and our initial design. We also have received a commitment from First Fed for $25,000, and they've invited us to apply again this fall for more, another $5,000 from Public Plaza. And the city of Port Angeles has waived our building permit fee, which will submit building permit in July of this year. And that's a huge investment. And the city of Port Angeles is talking about doing a 40% match for 1590 funds with the in comparison to the counties. So we're looking at probably another commitment of over $700,000 from the city of Port Angeles. We've made a request to the Behavioral Health Advisory Board that they're going to review in July. We have been committed by the city to some access to some of the NICE funds for infrastructure, things like sidewalks. We know we're going to have to put in ADA compliant sidewalks and those sorts of things. We did submit a federal appropriation request to both Derek Kilmer and Maria Cantwell in hopes of getting some support. And our biggest chunk of funding we're hoping for is an Apple Health and Homes grant or loan from Department of Commerce. And we'll be applying for that in September of this year. So the opportunity to apply for that comes out in June, and it takes a long time to build those applications. But this community has indicated to us that they are very, very committed to making this happen. We expect it's going to be about 10 to 12 million. We do have to pay prevailing wage. We'll have to actually pay Davis-Bacon prevailing wage. And one of our goals with this project is to try to keep as much of that in this community as possible. With Donview Court, all but a couple of subcontractors, asbestos and those sorts of things, those dollars largely flowed into this community. It's important to us to support our community in continuing to thrive. And where we can, we try to identify how do we bring in contractors who will use local subcontractors, who will help feed some of those dollars right back into our economy. We're a business as well as being a healthcare provider, and we know that when people in our community have access to good jobs and financial resources, it makes all of our lives better. And then those tax dollars also get reinvested into our 1590 and 1406 funds. So we're really, really committed to trying to work with our architect when we put out the request for qualifications to build some requirements in there around using local contractors. I'm not sure if we have any contractors in our community who will come in to bid on this project because it's a pretty big project for most local builders, but we have been talking with a couple of folks in the community. So we're really excited that we've had such good support so far, and I anticipate more. We're well on our pathway to being able to fully fund this project, and it's our goal to We have the schematic designs complete now. So we finished those this week, finalized those, and we'll be trying to get to a point where we have the plans complete enough for permitting process by mid-July. We've been working with the city of Port Angeles, the fire department, and all of those players in the pre-design process to make sure that everybody's on the same page, that we're communicating about what we really need to be doing to make sure that this project goes forward without hesitation and delay. Our aspirational goal is to complete this build by the end of next year. And I think the realistic goal is no later than the end of first quarter of 2026. So we are not delaying, we're moving forward. You know, we've got our engineering team on board, and we're just really excited for this opportunity to, again, make a significant dent for the people who need housing the most, the people that people call me about all the time and say, hey, can you help us with so and so? And we send our outreach teams out. But at the end of the day, there's got to be a place for people to be. And right now, those resources are limited. The resources for my workforce are limited. And so, you know, when you think about if you're an apartment manager or if you have a rental house and you have somebody show up who's been chronically homeless, maybe doesn't have the best hygiene, and also have somebody show up who's well groomed and has a job currently and isn't just living on disability income, who do you think you're more likely to rent to? It's not likely going to be that person who has more challenges. So we're not trying to solve the whole problem, but we're trying to be part of the solution for this community in terms of some of those folks who have some of the highest needs, having access to resources for them. And we know that Housing Authority has a wait list right now for 1-bedroom apartments. It's about 2,000 people deep. So we know that there's lots of opportunity. And, you know, I'm excited that we've got some great partners in this with the county and the city. When we were pulling our federal appropriation requests together, we received 37 letters of community support to support this project. And I hope that I can maybe take some time to answer people's questions now.
Great. Thanks so much, Wendy. We do have some questions in the chat. Let's see. Okay. I think the first one is from Julia. I may have missed some others, but there's a lot of questions that came to me. Let's see. So Julia, do you want to ask your questions or would you like me to share what you wrote?
Oh,
So
it's not a question. I just wanted to make a comment that I literally like 2 days ago just moved back to Mercer Island to King County. I'm really impressed with your housing program. The fact that you have so much supports, the fact that you understand these little details that are like so huge to success, like needing to keep the pets. I've worked with people that would literally not go to a shelter.
Yep.
And I mean, they would rather die and stay with their pet. And just, I'm really, it's very inspiring to hear. So I just wanted to make a comment, and I definitely want to talk to some folks here and say, hey, if you're open to it, say, hey, I want you to talk to PBH up in Clallam County about what they're doing.
I'm always open. And you know, we're not doing anything magical. You know, when we first started with Donview Court, what we heard from the community was, is this going to be housing first? And there was a lot of concern in that comment. And there are some successful housing first programs out there. And, you know, we have successfully housed some really challenging folks in this community, but we're treatment first. So Peninsula Behavioral Health, when we do housing, you have to be in treatment. It doesn't, with our apartments, it doesn't have to be with us. And one of the things that came up yesterday when I was talking at the Behavioral Health Advisory Board was a local substance use disorder treatment provider saying, you know, we really thought PBH was not going to do that, but they have referred people to us that are housed at Donview Court. So, you know, we're a treatment agency, and there are other organizations who approach housing differently, but we always approach with treatment first. And part of what that means is when we do treat people with substance use disorder who are living in our housing, you guys, we know people relapse sometimes. but we see that as an opportunity to intervene, especially when people are a captive audience. And I'll tell you, neighbors in our housing, they rat each other out. So they want a safe and stable place to be. And our housing is sober housing, but that doesn't mean that, if someone were to relapse, they're out the door, that they're evicted. And there are behavioral health treatment programs that's their rules. And our rule is you got to be working with us to get that back under control so you can live a healthy life. And we've been really incredibly successful with that.
Got it. So let's see, George had a question. What happens to individuals being released from involuntary care when no units are available?
So that's a great question, and individual results will vary, right? So some people are able to go back to family situations or friend situations. Some people end up in the shelter, and though nobody wants it to happen, sometimes there are just literally no resources available, and we do see people sometimes discharged to the streets. That is never an optimal situation. Our ability to be engaged in that discharge planning process varies depending on a number of different factors, but we actually have a peer bridger who will go to the hospital and meet with people before they come back to try to make sure that there's a viable plan. Admittedly, sometimes hospitals discharge individuals without ever telling us, and then we see them walking down the street. And then we track them down and try to make sure that they have the adequate supports in place. We don't always have a solution. There's not always an option. And during the winter months here, we're able to use motels sometimes for short-term housing options. If somebody was truly coming out of inpatient and they didn't have a place to go, we use our crisis stabilization program as a step down so people can stay up to 2 weeks while we problem solve what a better solution is. But sometimes 2 weeks is not enough to solve the housing issue for an individual.
Mm-hmm. So, what's the total cost of the development you're doing now? Not the one in Sequim, but the one in PA? Do you have a?
Probably right around 12 million. 10 to 12 million is kind of what I'm hearing until we, so have you guys heard about the new energy code changes? I'm so excited. Yeah. I get to have an EV charger at this low income housing facility. That's exciting.
That's crazy. Unless you had a vehicle that supported them. I mean, these are generally people that, well, like you said, really low income. Are they going to be able to afford an electric vehicle?
No. And so some of the costs that we're still sorting out are, our EV charger, our 34 solar panels that will be on the rooftop of this building, which are also part of the new energy code requirements, and air conditioning. So you guys know that the summers have been hotter lately. Imagine being in a 4th floor apartment without air conditioning. And what I'm hearing from the architectural team is, oh, we don't usually put AC in low income housing. And I'm like, I don't know how you cannot have AC in new construction 4 stories in this community. It doesn't happen often, but our folks as well often have a lot of difficulty regulating in their own temperature. And so what I'm hearing is because of the new energy code, we will be seeing the air conditioning units coming in at about 15,000 a piece on this project. But I think it's really important from a safety standpoint with folks with serious mental illness who often can't tell when they're getting overheated. They're at high risk for heat stroke and overheating. I don't see how we can not do it, but there's some new surprises in the new energy code, and we're still trying to flesh all that out.
What's the definition for serious mental illness? What qualifies, what doesn't? Or is it just kind of a general term?
It's just kind of a general term. And when we think about people with serious mental illness, it's often people who are likely to struggle with the illness through the lifespan. Some of us can have transient episodes of depression or anxiety. It's typically illness that impairs your daily living. So we often think about people with severe bipolar disorder, severe major depression, people with schizophrenia or schizoaffective disorder. We but we also know that it ebbs and flows for some people, right? So one of the interesting things about the illness, like so many others, is it's not static, it's dynamic and changes over time.
Okay, thank you. Let's see. So there was a question here about so back to the facility that you're building at about 12 million with your estimate. How much of that is due to the evergreen development standards that are required because you'd be getting state money? Or is that triggered just because of 1406 and 1590 local funds?
No, Evergreen sustainable development standards get triggered when you access commerce dollars or
Okay.
housing trust fund dollars or HUD dollars in Washington state. So interestingly, very little, because that new energy code is superseding most of the Evergreen Sustainable Development. Most of our credits for ESDS are now going to be met because of Washington State's new energy code requirements. You know, and we get some additional points because of our location, because of having nice views is considered healing in the ESDS, being walkable to our swimming pool and to our grocery stores and to our downtown. You know, we get points just based on our location. So we're actually not going to see a lot of cost driven up by ESDS on this build like we did with Dawnview. Where we are going to see that is with the new energy code, and it's going to be hundreds of thousands.
Okay, but not millions.
I don't know yet. I'm waiting to find out. I haven't, nobody's quite got this whole solar business dialed in yet. We also are having really complex air exchange is now required as part of the energy code. We are having a lot of complex systems. Our water system will be a water pump or a heat pump water system. So, you know, there's a lot of costs associated with this technology that we haven't finished the design of some of the mechanical systems, and that will drive a lot of that. So the electrical mechanical is going to be a huge cost in this facility.
So Stephen had a great question. He was saying he's curious about Peninsula Behavioral Health's financials, given the county's largest employer, OMC, continues to lose money. OMC blames the 85% Medicare, Medicaid mix, and that reimburses at 70 to 80 cents on the dollar. What is the payer mix for PBH and reimbursement rates similar as PBH's model, more financially stable?
So we bill very differently than the average healthcare provider. We have probably, Dawn's on the call, my CFO, but I would say we're probably about 85% Medicaid at this point, with 15% Medicare, private insurance, and individuals who don't have the ability to pay. We've had a rough year because our reimbursement is tied to how many people are enrolled in Medicaid. And with the public health unwind this past year, the state predicted we'd see about 6 to 8% of Medicaid enrollees lose their Medicaid, and it was closer to 15%. And so we didn't budget for as big of a decrease in our Medicaid revenues. Most of our contracts aren't on a fee for service where you get paid for a widget. We do more capitated contracts. So we're doing population health management with our health plan partners. So our funding has stabilized. We look like we were going to come in probably in the red this year, but we are in a solid financial position, and we will end this year in the black, which is always the goal as a not-for-profit. You like to see, 3 to 10% margin, but many years we don't. In the 8 years that I've been CEO, we haven't had a negative year. So we're doing a great job, and we've got a really excellent team that is always keeping their eye on our financial health and well-being. And that's part of my board's job when I come to them with these wild projects and say, hey, maybe we should do this. Hey, maybe we should build this building, or hey, maybe we should buy this new office in Sequim, is we always take a deep dive into our financial situation to make sure that we can weather that storm. And, we've also worked hard to build up a bit of a reserve so that when we have those bad years, it doesn't impact us as much. But we're actually in a really strong financial position right now. And we're able to, which we have to be, because we have to be able to leverage our resources to make some of this happen. Almost all of these funding sources, they're on a reimbursement basis. So when I come for my 2 million from Clallam County, I have to spend that money and be able to wait for it to come back to me, which, PBH is in a unique position as a not-for-profit to have the resources to be able to do that. Otherwise, we'd have to take out a construction loan and be paying interest on those dollars constantly throughout, which would drive up the cost of our construction project.
Mhm. Can you talk, or maybe Tim can, but 1406 and 1590 money. I don't know that everybody, I think I did know at one point and I've forgotten. But so there are two different revenue sources that were options. And can you describe those and how like what are the cities doing with their funds and how are they different?
Still muted, Tim. There you go.
Oh, I'm still muted. Okay. Yeah, the 1406 and the 1590. The 1590 is 1/10 of 1%, and the
Of sales
1406
tax.
of sales tax, sales and use tax, and the 1406 is also, but it's a smaller percentage of the sales tax. And
Why? If it's
it was
0.1,
initially, huh?
if
Go
it's
ahead.
0.1, how would it be a smaller percentage?
Because the 1406 is not 0.1. The 1406 comes in at
Oh,
0.04 something percent.
okay.
It was
Okay.
it was the initial start of the affordable sales tax and use that came out.
So was that additive to existing sales tax, or was that something that came from the state's 6.5%
It comes
portion?
from the state's 6.5%. And then
Okay.
with the 1590, the 1/10 of 1%, that was something that they gave that the counties or the cities, it's initially started out, Port Angeles had to go out, they took it out to the vote of the people for it. And then a year later, it came back and they said that the county could implement it without a vote of the people. And so
Okay.
that's what's happened. It both serves for populations under 60% of AMI. And it works at veterans, disabled, seniors, people that are at risk, homeless or at risk of being homeless. So, but like say, with the 60% of AMI and below, it's figuring into a very specific set of people. And then, they'd also do things. The 1406 is it gets into rehabilitation housing. And then the 1590 is really construction of either construction or purchase of housing. And it looks at housing or housing services.
But not rehab.
Tim, doesn't it also like 30% of 1590 funds can be wraparound services and other types of things that like Wendy
some
offers?
O&M stuff.
It could be some O&M costs, yes.
Well, and services. I mean, I think
but
the kind of
60%,
services Wendy just
40%
walked
is
through.
60% has to be used for that. One of the other things is like, say, 1406 can't be used for allocate or acquisition of land. And then when they came down with 1590, they said, okay, 1590, you can purchase land for it. It can do a lot of the soft costs, but one of the issues with the soft costs is that if the project doesn't get completed, then those soft costs have to be reimbursed. So it runs into that you really need to make sure what's going on. And really, a lot of these funds are used for kind of gap funding. You know what? They want to be first in money when you're going to Housing Trust Fund or Housing Finance Commission, or if you're going to, I was on the phone, I had a meeting with HUD this week, and looking at 811 money, which is, money for disability housing, and some of those sort of things, and 202, which is senior housing. So, but you want to, this is money because, like say, the county generates probably about $1.4 million of 1590 funds. And the city is probably I think the city of Port Angeles is somewhere in a $500,000 neighborhood.
Yeah, and so probably to clarify that, Tim, I know you know this, but others on the call might not. Because PA exercised their option to implement the 1590 in a city, they own their 1590 funds. The city of Sequim chose not to, so that all of our contributions, we still make the 1590 contribution, of course, but
Right.
it goes to the county, which acts as the administrator for Sequim and the county. So
Correct.
Sequim is participating through the county in all of these efforts.
Which is why we access the county dollars to do the rehab of the Sequim facility.
Yeah.
So
And those
you
are bigger,
using city
those are
dollars?
bigger numbers. Our 1406 is like only 30,000
Right. Yeah. Because like
a
say,
year or something like that, whereas our 1590 might be 1,000,000 or something.
oh
So
no, you're about 500. You're running about the same neighborhood. Port Angeles. The thing with Port Angeles is that Port Angeles went out to a vote of the people.
okay.
With theirs when they actually started, that they took it out there, and that's kind of where it's at.
So the funds that are being used for the property in Port Angeles, are they Sequim funds as well?
No, they're county funds.
Well,
the county gets the allocation, and the county looks at projects across the county.
yes,
And
Sequim
they-
contributes to the county, and the county is the administrator, and they are looking at the whole county. So
Yeah.
our council chose to just not set up an administrative
Separate.
responsibility, but to contribute to the county, knowing the county would take care of the east side of the county.
Yeah.
So
Yeah.
And that's where the housing solution committee is made up, and it's one of the things that oversees these funds is the housing solution committee that's part of the county, but it has Rachel Anderson that is a city council member for Sequim, Nathan West, a variety of people, Rod Fleck from Forks sits on this. This is we have the port, we have Colleen sits on it, we have Goodwill that's on it, Peninsula Housing Authority, a variety of people that are looking at these projects from a county perspective and going, okay, you know what? And it's kind of like, say, a project like this with Wendy Second and Oak, that it's not limiting its demographic. You may be in Port Angeles, but it's helping people countywide.
right.
And that's kind of the project that we're looking at with these funds.
Well, that's good clarification. I'll be sure I'm considering that
And
as we apply
Tim,
projects, because geographic equity is important.
I was going to say, Tim, since PA exercised their own 1590 option and have their own funds, they don't then contribute to the county 1590 funds, right?
No, but one of the areas that we do look at is that if a project is going to be within Port Angeles, that the people need to be applying for Port Angeles money in addition. The county isn't funding these projects alone.
Sure. Sure. No, that makes great sense.
One of the caveats that I really want to point out here, that, you know what, we're looking, the whole purpose of this is partnerships.
Yep.
And that's where we're building.
So we got one last question from John, and then I think we need to wrap it up. Can you help a mental health cause jailed inmate to get released to a family member's house?
And the answer to that is a big no. We have very little sway over the courts. There are times when the courts will ask us to come in for a recommendation, and that's a little bit more successful. But you know, ultimately, the jail staff have no control over when people are released from the jail. The mental health staff have no recourse there. That is entirely driven by the courts and the court system. So, you know, families are encouraged to advocate directly with the judge. And we just, you know, we are also beholden to the power of the court. Which is a great question, because we get asked that a lot.
Thank you.
Got it. All right. Well, thank you, everyone. And I'm going to stop recording, and thanks so much, Wendy. We will finish up this call, and it'll be available on our website. Thank you.
Thanks, Colleen.